Frozen shoulder is what we call technically adhesive capsulitis. Basically, it is a condition that is actually quite common. We don't always know exactly what causes it. People just basically start getting, a gradual loss of range of motion in their shoulder and a gradual increase in pain in their shoulder. Barely noticeable at first, but over time it's gradually getting worse and worse, and they're starting to lose motion, and they're starting to get more painful and start having trouble doing their activities of daily living because their shoulder won't go where it needs to go. A lot of times night pain is a frequent complaint, like not being able to sleep because of it. We know it is more common, a lot more common in people with diabetes, but other people without diabetes can get it too. It can happen after some injuries, but oftentimes it happens just by itself, just out of the blue. And when it does happen, it can sometimes be relatively mild, or it can be quite severe as far as how much stiffness there is, how much loss of motion there is. Initially, we treat that again with physical therapy, which is, aimed at trying to restore motion in the shoulder. Now, in situations where, we've been trying that and it hasn't really helped, and patient isn't progressing, they're having a lot of pain and stiffness, then surgery can be helpful for that, to go in through a scope, an arthroscopic surgery with little tiny incisions, where we can go inside and release the scar tissue in the shoulder and free up that motion and get it back in there.